Alright, so hello everybody. Excuse my curly mess on top of my head this morning. Just woke up. I had a super long week this week and just wanted to give an update for everybody that's following my journey. So the other day, I'm losing track of my days because everything is starting to I don't know, just come together. Because it's like I'm at the doctor almost every week. Every day. But I think it was Monday or Tuesday. Either Monday or Tuesday, I went to see a hematologist because I was referred by my rheumatologist because he saw some things in my blood work that he was actually concerned about. And my hematologist, a hematologist, and oncologist. So at first I was just like, why does he want me to see a hematologist, oncologist? As some of you know, I have a history of cancer, Hodgkin's lymphoma, so I was concerned about that. And with him not telling me what he saw in my blood work was really concerning at that point. So I went. She discussed with me what he was concerned about. A few things with my cells he was concerned about. He was concerned about my deep bone pain. And he was hoping that she would possibly do a bone marrow procedure. And I got to thinking, and I was like, even when I had lymphoma, I never had a bone marrow procedure, which I think, is kind of weird. I would think they would have given me a bone marrow procedure to check my bone marrow, but I was never tested. So in my mind, I'm like, oh Lord, this could possibly be some type of cancer. It's in my bone marrow now. You know how your mind just gets to going. But, I just would have thought that I would have had a bone, now that I look back, that they would have checked my bone marrow when I actually had cancer. So, this doctor is amazing. She looks, like she's young, like she's my age, but she's actually 39. Her name is Dr. Spratlin. I love her like I loved my oncologist. There was no other doctor that I love so much but my oncologist. Well, my first one that I had, Dr. Ferrante. And I love her a lot. Like, she has the best bedside manner. She actually spends time with you like my first oncologist. And not a lot of doctors do that. They honestly only have a certain amount of time they're supposed to spend with the patient. That's why sometimes your doctor's appointments may seem so quick. And that's something I hate because, I have questions. I want them to explain things. And then that just makes room for a patient to call and bother you as a doctor. Call and email the doctor. And I think that's a little bit extra. I feel like I need enough time to express everything for them to educate me, get as much information as possible. So she spent so much time with me. I don't know if that's because my history was so far back, like, the cancer, then the meningitis, now the lupus, mixed connective tissue, rheumatoid arthritis. I can go on and on. I now have 11 diagnoses. I can go through them. It's the mixed connective tissue disease, the lupus, the rheumatoid arthritis. What else? Irritable bowel. But I could list them all. But neuropathy, I can just keep going on and on. I've been diagnosed with so much. And, just starting a new journey because the hematologist told me this is not going to be a TV show. This is going to be a journey. But she assured me that we'll get down to whatever is going on. And I really appreciate that. A lot of doctors, I hate to say, they just, stop. Or they refer you to somebody else. Or they say, oh, you're okay. Which I got a lot as a child. Oh, your blood work looks good. No more further investigation. And then I end up with stage 3 cancer. How was I okay? I was not okay. But I just appreciate the time that I really do that she spent with me, and she ensured me that everything, was going to be taken care of, and we're just going to start a whole new journey as far as, cancer. But she did discuss a few things with me. Next week, I do have to go back to Vanderbilt. That's where I'm being seen for my lupus and now for cancer. So I have to go back, and I actually am going to see someone to do a PET scan. I actually got to have a PET scan done, which I've done numerous times over and over. Pretty much, for those who don't know what that is, it's like going into it's like an X-ray, but it's like an MRI if you ever had that, or a CT scan done. You basically just lie down. You can have it with contrast or without contrast, which is actually a dye that they use. They start an IV and they put it in your vein. For those that don't know what an IV is, so they put the IV, they strap the catheter in your vein, remove the needle, and then they start a dye that's actually put into your system at the time of the scan, at a certain time during the scan. It's usually towards the end of the scan. And that dye is not harmful. It can make some people feel nauseous or sick. I've never had any reaction to it. But as far as that dye, what happens is it lights your body up. So if you have anything abnormal going on, like cancer cells or any type of inflammations, anything abnormal that's not supposed to be in your body, it'll light up. And like my doctor, my hematologist said, she said, you will probably light up like a Christmas tree because of the inflammation that you have going on. So she said, we're still going to we know you're going to light up. I know that I still have lymph nodes in my body. Even though my cancer is in remission, it is still there. And that's what they're worried about, my cancer reactivating. Because my cancer, the type of cancer I have, it doesn't go away. It's still going to be there. It's just not in its active state. And with all the inflammation in my body, and with the lupus attacking healthy tissue, with my immune system not responding and being deficient, only responding, not responding to 22 out of 23 significant viruses and infections that I need to respond to, my cancer can basically reactivate itself at any time. So they really want to keep track, on that. So basically, like she said, I'm going to light up like a Christmas tree. They know I have inflammation, but then again, what kind of inflammation is it? Is it just from the lupus, or is it other type of inflammation? So more than likely, she said she's going to do a bone marrow test because, yeah, you have inflammation, but we got to be sure as to, what it's related to. So a bone marrow test, basically, they're going to stick these big type of needles into my bones. It's actually very painful. You guys know I can take pain and tolerate pain very well. I have been in the greatest of pain, probably in more pain than you guys ever experienced. And that's an everyday thing. And this procedure is painful, from what I heard from other people. But my doctor said, look at I was concerned about this, and I'm never scared of procedures, but I just heard so many terrifying things about the pain, and then I think you're actually awake during this. So my doctor said, look at your list, look at your history, look at everything you're going through. Why are you worried? This is going to be a piece of cake based on everything that you've been through. And so that's how I'm kind of starting to look at this whole new journey, cancer journey or what have you. I'm starting to look at it differently. Like, I've been through all of this, the rest of my walk should start to be a piece of cake. And that's how I'm trying to keep my mindset. But to be honest, I'm just getting worse and worse. Like, as the days go on, the months go on, I'm having more symptoms. It's just getting terrible. My hair started thinning. My hair is starting to come out basically from some of the chemo medications, and these are chemo medications not for cancer, but chemo medications for my lupus because it's out of control. One of those chemo medications is not working, so I've been placed on another one, which is more than likely not working because these are lower dose chemos, and my body is probably used to higher doses, and I really don't think there's not going to be much improvement. There hasn't been, so far with being on these medications, and I'm just not responding to them. But basically, just want to give you all an update. That was what's going on with my hematologist. I once said I wish that I documented my cancer journey a long time ago. And now it looks like, I'm going to have the opportunity to do that again. My cancer may not end up being basically active again. I hope not. But at least I can document the journey, because it is going to be a journey and a continuous journey. So at least I can document that. And I'm actually grateful, for the experience and, given a second chance to actually do this and do this for everybody. And I just wish I was able to I just thought about these things when I was 16, I was 15 when I was diagnosed with cancer, and just nothing like this came to my mind. Everything just happened so quick. I hardly remember my cancer experience because I did well with it, but everything is foggy. It was like brain fog. I remember high points as far as different surgeries, emergency situations, but my daily life, I don't remember it too much. But that's it on that. So I will have the opportunity to share with you guys another cancer experience. So that's a good thing. Now I'm going to share with you guys what just happened yesterday. So I didn't really tell anybody, but not because I was ashamed or anything. I just was so busy with appointments. But I actually had a colonoscopy, and endoscopy is when your doctor, which is a gastroenterologist, the endoscopy is when they go down your throat, check your upper part, and colonoscopy is when they go up your behind and check, your lower part, colon, esophagus, all that is check your whole digestive system, which is what I needed because my lupus has been attacking, and this is the first, besides my musculoskeletal system, this is the first major, well, I guess musculoskeletal is major, but this is my first actual system, really, that my lupus has attacked. My internal, I guess you would say internal, kind of like your kidneys and liver. This is my first system that my lupus has attacked. It has caused, from his findings, I was asleep during the procedure. You don't remember anything. Just if you have to have one done, don't worry, you'll be knocked out. You'll wake up, you'll be fine. Just probably a little stomach tenderness based on what they have to do. You may not feel any tenderness or nausea at all when you wake up, or any pain at all. But of course, I did, because I am really special when it comes to issues. So obviously, I had many issues when they went in. So I'm going to start off from his findings. He saw that I had acid reflux. So that's the first thing. I know many people are like, I have that, I had that. I had it too growing up, but it pretty much, how you grow out of things. I kind of grew out of it, and obviously I have it again. But basically, for those of you who don't know, acid reflux is a condition where your stomach content backs up into your esophagus, which is your swallowing tube, where you swallow. So based on that can cause like heartburn, regurgitation, bloating, indigestion, hiccups, even bad breath, asthma, which is funny. That's something new that they diagnosed that acid reflux has caused. A lot of people don't know that, but if you have asthma, you can most likely develop acid reflux, or if you have acid reflux, you can most likely develop asthma, which is funny because I do have both. It can cause like chronic cough, which is, I guess I can see how that would happen. Difficulty swallowing, of course, sour taste in your mouth, even pneumonia, because you do have to be careful. Things can back up, get into your lungs. A lot of just terrible things can happen with acid reflux. There are ways to control it. There's different medications, but even though I have a laundry list of medications, which there was added more that I would discuss, basically you can make these changes and live healthy with acid reflux through your diet. So I can talk more about that because I've actually changed my diet. But the first thing that he found, because he went through my throat first, he did the endoscopy. He found what is called esophageal, I can't pronounce it, sphincter. And it's basically your esophagus closing. So guess what he had to do? Thank God I was asleep and I didn't know. This man had to stretch my esophagus. I was having trouble with my food going down, swallowing my food. Lupus was just attacking me. I never had this issue before, nothing like this. And so he had, basically, it's esophageal dilation. It's where they go in and widen or stretch your throat, your esophagus tube. So now my food can actually go down and can get down to the digestive system, my stomach, much quicker, because I was having a problem with that. My food wasn't digesting like it was supposed to. I would feel my food stuck, lost appetite, wasn't really eating. So that's one thing that went on while I was asleep. Second thing, he lasered out 3 polyps. Never had issue with polyps in my life. I've always had irritable bowel. Never had any type of polyps. I actually been eating healthier. But with my mom, because the doctor didn't come talk to me, he went to go talk to my parents because I was still knocked out in recovery. But when I woke up and my mom told me, you have 3 polyps, I said, I can probably guess where they were in my lower abdomen. And she was like, yes, because I was having, sorry, someone's calling me. I was having so much trouble. I don't know if it's too much information, but I was having so much trouble with my bowels once they, having a bowel movement. Once they got down to my lower abdomen, I've gotten to the point a few times where I've almost, actually passed out before, in so much pain because, it just hurt when your bowels passed a certain area. And it was at my lower abdomen, right before, the bowel comes out, what have you. So I could guess, never thought it, I don't know why I never thought this, but I never thought it was polyps. Shoot, I don't know what I thought. I'm thankful, it wasn't nothing greater. But he did another diagnosis. He did diagnose me with something that I cannot pronounce, so I don't want to screw it up. But it is where your colon basically changes a color, which is a darkish color. It can be caused by prolonged use of laxatives, or it could be something else more serious. I did use a herbal type of laxative before, but I only used it for about a month, and it would have to be, and not even every day for a month, but I used it for a little bit, and so we're kind of unsure if that is what caused it or something else. So he did take a biopsy and send it off. He did see some other things, but in my digestive system that he felt was benign, which is not cancerous, but he still sent it off just to be on the safe side. Of course, all doctors do that with me because of my history. They get scared, which I'm thankful that they get scared because, we need to know if any cancer is on the rise because we need to get on that real quick. besides that, that's pretty much what went on yesterday. Like I said, pet scan coming up very soon. Another appointment with my hematologist, more blood work. We'll see where we go from there after the pet scan. And I have a rheumatologist appointment where we're going to be discussing Benlysta. I'm still trying to get money, for that because it's very expensive. Your insurance actually has to approve it, which is going to be a whole nother process that can take weeks up to a month. And the way I'm feeling lately, I don't know if I can wait. I've pretty much been on medications that haven't been working for me. They've been keeping some things subsided, but I haven't had any relief since December, and that is a long time to actually tolerate this amount of pain. This isn't me, but I can see how patients that are having chronic pain, actually commit suicide or, take way more medication than needed, become addicted, to it because, this pain, you won't know until you've experienced it. This pain is really unbearing. It takes over your life. Like today, it is, what time is it? It's 10:43, and I've been up for a while, and I could not get up out of bed. I have to take pain medicine every morning just to be able, and have to wait for it to start helping a tad bit just so I can get out of bed every day. So that's the type of pain I'm in, and it's really like I cannot move. My joints are stiff, my muscles are stiff because it attacks my muscles. Just every bone, every muscle in my body, it's just been attacked and even damaged nerves. That's where the neuropathy comes from. It's just really bad, and I hate that a lot of people are going through this type of chronic pain, and I hate it for myself. So, just word of advice, anybody, just try to keep positive when you're going through any type of pain, so you don't have any negative thoughts. But I can say, all of this, like possible cancer, having to go through that journey, lupus, and the pain I am starting to become a little overwhelmed. I think it's starting to get to me. That's not saying I'm not going to continue my videos, which I am going to continue. That's a promise I made to myself, my followers, those that are concerned about me, and, to God, I promise that, I would show, my journey and give my testimony. So that's something I'm not going to stop doing. I don't care if I become depressed, how depressed, I will record depressed. I will do whatever I have to do, especially what I promised, God, that I would do. So, I did, I'm not too much of an emotional person, and, I don't do too much crying, but yesterday, I did cry, and I actually was crying, and my mom was laughing at me, because I actually started crying because it was this is going to sound weird, it was like the last episode of Frasier, and that is one of my favorite, that's like one of my favorite, older shows, and me and my mom have been watching the whole series, and I don't know why, I just started, it's probably, honestly, because of my procedure yesterday. I didn't take my Cymbalta, and that is actually an antidepressant, but I actually am giving it for pain, but I think it's honestly actually keeping me from being depressed, which I'm thankful for, and I will continue to take that. But I didn't take my Cymbalta yesterday, and I just started crying, and my mom cries from movies and stuff, it can be the smallest thing, she cried on Cheaper by the Dozen, come on, who does that? But she just started crying, she started crying too, but she was crying because of the show, and I was crying because of the show, but then I just started thinking, once you get in that emotional state, you just start thinking about everything else, and I just could not stop crying. I literally cried. I was crying, and then I was laughing too. I was laughing at myself because I was crying, and I was just crying for probably about like almost 30 minutes, just nonstop. But I was laughing. It was just a weird thing. But I am, and I'm gonna be honest with everybody, I am overwhelmed. I hope that depression does not set in. I honestly see it going that way. I'm thankful that I do take an antidepressant and I haven't been depressed yet, because just the pain itself can cause depression, and it's very common, like I said, with people with a chronic illness and chronic pain. So just keep praying for me. Those of you that are spiritual, and believe in prayer, just keep praying for me that I can keep out of that type of mindset and that I don't get in that state, But I think that's pretty much it that I have to share. I'm trying to think. Yeah, that's pretty much it. I was giving by my hematologist one medication, actually two medications. She wants me to take Tums, which something I did not know, and I was like, huh, and she kept saying Tums. I'm like, huh, because I did not know Tums was actually a good source of calcium, and I was thinking, that's just for my digestive system. Why is this lady telling me, to take Tums? So I was just, really like, what? Take who? How much? She was just like, Tums, like I was stupid, but I was stupid. Like, I was dumb to the fact that Tums is a good source of calcium. So, Tums is in my daily regimen. I also have to take Prilosec because of the acid that's caused by long-term use of, Lord, what is it called? Steroids that I'm on. Can't seem to get off of them. Hopefully with the Benlysta, if I can do the Benlysta, that I can come off of them. So, was just prescribed a prescription of Prilosec. You can't buy that over the counter, but I was given a prescription for it. And then yesterday I was giving something that I'm gonna mess up. It starts with an L for my stomach situation, my irritable bowel. I was given start with an L. I have to take it 2 times a day, and it makes you go it makes you go to the bathroom. And the nurse called me and was like, you were prescribed this one time a day. And I was like, no, twice a day. She was like, he wrote on it twice a day. She was like, are you sure it's twice a day? And I was like, yeah. She was just like, okay, make sure for the next 2 days you are at home on taking this. And I was just like, okay. So even when my dad went to go fill the prescription, even the pharmacist was like, you're prescribed this twice a day? And my dad, just like, yes, isn't that what it says on the prescription? They was like, yeah, but the usual dose is once a day. Of course, me, I get something, had to take something that's unusual. So that's going to be a whole experience. After doing that bowel prep for the colonoscopy and endoscopy, I meant to tell you that, you have to drink like this nasty, it's the consistency of the stuff that you have to put in either water or some type of juice, that's not, have a red dye or a blue dye to it. It makes it like thick, almost kind of like a mute. It's just disgusting, and you have to drink it. You have to finish it all because it has to cleanse you totally out. So thank God I don't have to drink anything daily twice a day, but it does work. Like the bowel prep works. I have to take it twice a day because my lupus is attacking my digestive system, causing it basically to constrict, and for my bowels not to act properly. So yeah, that's what I forgot about that. So if you have to do a colonoscopy, just beware. Honestly, the prep is worse than the procedure. To be completely honest, and that is sad. Like, that is so sad, but it is so disgusting. But you can ask anybody that's had it done before, they will tell you, the worst part is over, drinking that nasty stuff. But yeah, that's all I had to share. But I was given those 3 new medications. possibly a fourth that my hematologist is going to talk to my oncologist. No, my hematologist is going to talk to my rheumatologist about, because with being on steroids for a long term, I also am supposed to be taking something to keep me from getting infections. And it's just a little bit much. I already take like 1,000 pills, and that's starting to get overwhelming. I'm starting to get to a point where I don't even want to take my medicines anymore, but I know that that would do more damage than when it's already done. I will hurt worse. I probably will die, honestly, if I do not take my medication. I already feel close to death. I know I'm not close to death, but man, it's a bad feeling. But anyway, that's all I have to share. Hope this was educational and you guys learned. It is Lupus Awareness Month. I'm sorry I did not get to record for the last 2 days, but you know, it's just been crazy. I couldn't record yesterday. I was throwing up and was in pain from the procedure. Couldn't do that. The day before that, I was doing that nasty prep, and I'm sure y'all didn't want to see me run into the bathroom, so I did not record those 2 days or post the video. But that's all I have to share. Like I said, I hope it was educational. You guys learned something. Thank you once again for following my journey. We'll have another journey together with this cancer experience. So just be on the lookout for my first cancer vlog. Or video, what have you. Haven't done one on it, and so I guess I will start after I go to my next appointment. So yeah, so I hope you guys, whenever you're watching this, hope you have a great day, evening, morning, what have you, and we will see you all next time. Thank you.